is Alice Litunya. I'm a Kenyan, and I live in Nairobi. Occasionally, I live up country with my mother. Tinnitus is a problem that impacts on people's lives. I remember I had this cold. It lasted a month. I used to have this problem of hearing some noise in my ears, and it used to come when I have a cold. When the cold goes, it will go away. So I thought it was something that comes as a result of a cold. But there's this time that I had a cold for 1 month, and when it left, tinnitus did not leave. It's the noise that you hear from your ears throughout day and night. This sounded like the various noises you hear when you're standing under a transformer. And it was difficult. I couldn't sleep at night, so it's like you have 24 hours of day. But as I was seeking medical services, I was told that this would not go away easily, that it's something I have to learn to live with it. I could not imagine how I was going to stay spending lots of my nights awake. I visited various places for support or to just find out how they could help me. I visited a place and I was referred to Stucky. When I arrived here, I was pleasantly surprised when they told me that they had a gadget that could help me. I was thrilled. I said that I'm not going to have these nightmares. So I talked to them. They were very kind to me. Whenever I had an issue, they told me that I could just come and visit them. Very surprising that they were not asking for payments when they were supporting me. They were looking at my gadgets. They were asking me what issues I had, and for quite some time I was happy. I was happy because they had changed my life. I would advise them to see an audiologist because there's a solution. There's a solution to their problem. There is relief, which is very important. There is relief. I was able to be given these gadgets that I don't have to remove the battery in and out. Since they're automatic, they're rechargeable. I can remove them, put them in the charger, full light, and take them out and put them on my ear. I can use them anytime. I can use them at night. I can use them during the day. And that was a great relief for me.
starting with my far right, with my immediate right, sorry, is Dr. Lillian Wairimo Moko. Dr. Wairimo is an ENT head and neck surgeon, currently serving as a volunteer surgeon with Operation Eardrop Kenya. When Dr. Wairimo is not helping her patients, you'll not believe this, but she's actually a photographer. Need to tell us something about that sometime. Karibu sana daktari.
Thank you very much.
And on my far right, we have Miss Eva Wairimo Mwangi. Eva Wairimo is a senior audiologist at Starkey Africa. And something you did not know about Eva is that when she's not helping her patients hear better and live better, Eva sings in a band. So we have an interesting group of lovely women joining us and professionals joining us today. And ladies, please say a hi to our guests joining us this evening.
Good evening, everyone. Thank you. I hope you benefit from this conversation.
Thank you, Daktari.
Good evening, everyone. It's my pleasure to share information, knowledge, and my experience regarding this very common thing that most people do not know about. So it is my pleasure. Thank you for having me here.
You're very welcome, Daktari. And so let's get right into it. About 120 million people worldwide currently suffer from a severe form of tinnitus. Daktari, this question goes to you. So what is tinnitus?
Okay, tinnitus from a layman's point of view is basically having noise in your ears when there is no noise in your environment. That is the easiest way of putting it. So tinnitus medically is the ringing of the ears without external sound. So you perceive voice in your ears or in between your heads. Some patients will say it's in between the head and there is no external stimuli, or they cannot identify the source of that sound.
Right.
Yes.
Okay. And Eva, this goes to you. You have obviously seen patients before who present with what Daktari is terming as a noise in the ear, a ringing in the ear without any external stimuli. And what has it sounded like for them? When the patients describe this noise to you, what have been the words that they have used to describe it?
Okay, thank you for that. So most patients will describe this as a ringing, a buzzing, a chopping sound. Some people will say there's a cricket sound in their ear. I mean, it can be any sound. Some people have even said they're hearing songs in their head. So, I mean, it's just, you find that because the most common type of tinnitus is the one that is subjective, meaning that it's the person who is suffering from it that can hear it. You find that it's just a form of things that they hear, and it can be anything. But most commonly, it's a ringing, high-pitched ringing, it's a buzzing sound, it's a roaring sound. In some cases, we also hear some people say that there's like a heartbeat in their ear, so we call that like pulsatile tinnitus. So it can really come in any form.
Okay. And so what I'm hearing you say, Eva, is that it does not take one form. Though we commonly describe it as a ringing or a buzzing or a hissing, it can take very many subjective types of forms. And again, Daktari, how common is tinnitus?
Tinnitus is quite common, and it affects 15% to 20% of the population. That is to say, out of every 4 people, 1 person could be having a ringing in their ears.
Okay.
Some people perceive it and ignore it, and they are able to ignore it and suppress it for long. Some people perceive it and it is very, very annoying. So the people who get to us are the people who we can talk about, the 20% of the population. The most other thing to know is for us as a country, we still don't know yet what percentage of people have tinnitus. But tinnitus is very, very common amongst the elderly people. So the older you are, the more likely you are to perceive tinnitus. And you'll definitely learn why.
Okay.
Yes. It is because they just don't, their hearing is declining, and so they keep perceiving that because it's like a warning sign for hearing loss.
Right.
Yes.
So just to follow up on that, Daktari, when you say that it is more common in the elderly, does that mean that young people are exempted from experiencing tinnitus?
No. Tinnitus is what we can call, it's actually a symptom.
Okay.
And so there are two types of tinnitus, where you can have subjective tinnitus, where you perceive the noise, and you can have objective, where it is really there. The noise is there, it is not that you're just imagining it.
Okay.
So why it is common amongst the elderly is because it is one of the biggest signs of a declining or a deteriorating hearing. But then there are other people, there are other things in the lifestyle, there are other practices, things like listening to loud music that can give you tinnitus. And these are things that affect young people. Yes.
Right.
So it has various risk factors or causes.
Okay.
Yes.
Okay. So I'm hearing you say that it is common, very common, about 1 in 4 people. And there are certain factors that can make tinnitus more prevalent in the population than, when all factors are held constant. And so Eva, can you tell us about these factors that can predispose you more to tinnitus?
Yes, sure. So as Dr. Irimo mentioned, hearing loss, you find that right now 90% of the people who present with tinnitus, in 90% of the cases, once we start doing the evaluation, we do find that there's some form of hearing loss, ranging from a mild hearing problem all the way to a profound hearing loss. In another 10%, there is no really hearing loss, but you find that noise exposure has probably caused that ringing to start. So you find that noise exposure becomes also one of the common ways that can predispose you from getting the tinnitus. There's the hearing problem. We also see stress in some cases coming in, and somebody develops the tinnitus over time. Okay. So yeah, those are some of the things that could bring about this.
All right, Dr. Ari, you have something to add?
So maybe if I can add onto that, is that medically there are many other things that can worsen or can cause tinnitus.
Okay.
So there are some diseases that have been known, or currently we've seen there are some diseases that are associated with tinnitus.
Okay.
And these are conditions that affect your blood vessels, things like hypertension and deposition of fat in your blood vessels, like atherosclerosis, and diseases such as diabetes. They are very common, and they are diseases that can cause you to have tinnitus, the ringing in your ears. We also have a lot of the medication that you take. If you take medications, especially aspirins and brufen, the NSAIDs, the painkillers, they are some of the most common medications that cause tinnitus. And we have other medications, such as some of the medication used for hypertension to treat high blood pressure, some of the medication. So that is another cause for malaria. That is another cause of tinnitus. You can also get tinnitus if you have an autoimmune disease. So these are people with diseases like rheumatoid arthritis and SLE. Those are some of the common conditions that cause tinnitus. Okay. There's also a special form of tinnitus which comes in a way that is, we call it vascular. She talked about it. It sounds like a heartbeat in your ear. So whenever you have tinnitus and you feel like your heart is beating in your ear, that points to a particular type of tumor that grows in the ear, and it grows in our blood vessels, and so it produces the sound of the heartbeat because of the blood that is transmitted in that space. And other than that, to mention more commonly, because we are having a very large population receiving cancer treatment and cancer medication. Cancer medication is one of the common things that causes tinnitus, either on its own or as a result of the damage that happens to your ear.
Right.
Yes.
Okay. So we've talked about hearing loss being one of the factors that can predispose you to tinnitus. We've also talked about bad listening habits. If you're always on loud music all the time, it can predispose you to tinnitus. We've also talked about certain medications that can predispose you to tinnitus. We've talked about certain health conditions that can predispose you to tinnitus. So there's a wide range of factors that can actually predispose you to tinnitus. So perhaps what our audience is wondering is tinnitus that bad? Or can I actually live with it?
So again, let me add 1, 2, 3 things to the cause factors. Just 2 things: smoking and taking of alcohol. Drinking and smoking cigarettes, e-cigarettes, and the shisha. All those are the 2 main things in the lifestyle that can cause tinnitus that we must remember. Now, to answer your question, tinnitus is very subjective. It depends on the person who is perceiving it
Okay.
and how they take it. So to some people it is very bad. It actually stops them from carrying on their day-to-day activities. To other people it is not so bad. So it depends on the individual and how they are able to take it and handle it as a person.
All right.
Yes.
Okay. Eva,
Just to add on that,
Yeah.
maybe, you find that the impact does vary, just like Dr. is saying, but you find that the areas of life that somebody would get really affected on is their ability to hear, their emotional well-being, their ability to sleep, and their ability to concentrate. Those 4 areas in their life which would trickle down now to even them having more stress, even in some cases have psychological symptoms such as depression and anxiety, by really just how bad and bothersome it is. Yeah, so we actually, one of the ways that we'll be able to start helping somebody is by just determining how bothersome is their tinnitus, how badly is it impacting their lives, so that we get to see how best to help them.
okay, all right. And just to pick up on that, Dr. When patients present to you with tinnitus, what are some of the common things that you would say you would see in a patient, so that our viewers can start to look out for these signs in their own lives and perhaps even in the lives of their loved ones, that, okay, maybe at this point we should be looking for help?
Okay. So it depends on the source of your tinnitus again, because tinnitus can also be caused by issues, mainly issues that have to do with the ear. So if you come to me as a patient and you have tinnitus, the first thing I want to find out is how bad it is and exactly what sound it is. That is able to point me towards what kind of tinnitus it is. For example, if you tell me you're having a feeling of heartbeat in your ear, I probably know I will look into the ear and I will look for I will look for something that could be growing in your ear.
Okay.
If you come and say you have a high-pitched ringing sound, I think you probably have been exposed to a lot of noise. So I will go towards your occupation where you spend most of your days, and probably you might be having a hearing loss. So you might be having a feeling of low sounds, or you find like you can hear from a distance. So that is what we look for. If you're having a common cold is one of the common causes of tinnitus because of the connection between the ear and the back of the nose.
Okay.
So whenever your nose is congested, sometimes you'll have that sound in your ear.
Okay.
Again, we will know that is the cause of your tinnitus, and we will be able to treat. But tinnitus from a flu is not supposed to last more than 2 weeks.
Okay.
So at that point, you should even be able to seek treatment from a doctor. If it sounds like a river, you probably have a problem with the blood vessels, but it is again not cast on stone, because we said the symptoms vary. So the most common ones are the ones for the heartbeat and the high-pitched ringing tinnitus. Those are the ones we are able to know. Other than that, the doctor does not know. So the doctor has to ask you questions.
Okay.
I have to probe into your history. I have to find out if you take alcohol, if you smoke, if you frequent clubs, so that I can bring out the real cause of your tinnitus.
Okay.
As she rightfully said, these patients will come with a lot of anxiety.
Okay.
Some of them will even come looking depressed. So sometimes we are not so sure whether it is the stress or the depression that is causing the tinnitus, because tinnitus has like a positive feedback kind of loop. So you get tinnitus, you get stressed, your blood pressure goes high, a high blood pressure worsens the tinnitus. So you get more annoyed, and then you become emotionally unstable, and then you fight with people around you, and then you get more tinnitus, more stress. So it's sometimes very difficult for you to point out the one thing. So for us, we use the sequence of symptoms and the patient's history to come up with what could be causing the tinnitus. And of course, we have to rely with the audiologist.
Right.
Before a doctor tells you this is stress related, we have to make sure your hearing is okay. And so the first step is always, for us, is always to send you to the audiologist before we now come back to talking about your tinnitus.
Okay, thank you, Dr. Viewers, please remember you can leave us your questions in the Q&A section, and we'll be getting to them at the end of this conversation. And Eva, Dr. has mentioned a very technical word, if I would say it, and the word audiologist. right? So you are an audiologist. And when it comes to tinnitus, how do you then begin to identify this as tinnitus? What does treatment look like for tinnitus? And how do you support these patients to live better lives by hearing better?
Thank you. So when they're brought now to our clinic at the audiology center, and the main complaint is tinnitus, first thing is we have to do a very extensive evaluation, which will begin from the case history. Just as Dr. mentioned here, that we have to understand how is their lifestyle, how is their occupation. We determine whether there's anything externally, internally in the ear, and this would be from the hearing assessment that we would have to do. And then we would also try to determine the pitch of the tinnitus. Exactly how does it sound, and even we are able to see from the hearing assessment exactly which frequency this tinnitus is coming in, if it's possible to get it. Most of the time it is, especially if it's the high pitch. We're able to determine exactly at what level and at what point is it coming from. In most cases you will find that there is also some level of hearing problem in exactly the same spot or frequency that the person has the tinnitus from. So once the evaluation is done, then we do a lot of counseling. With tinnitus, it's a lot of counseling, because you find that somebody has to understand what it is, some of the factors that will worsen it once it's already there, and also we have to talk about the treatment plan. If we find that the patient now has normal hearing, but the tinnitus is still there and it's bothersome, we provide sound therapy, and just the sound therapy will come in to mask the tinnitus that they are perceiving, so that at the end of the day they get some relief. So for a very long time, patients have been told that you have to live with it. There's nothing we can do, and that's not really what they want to hear. The message here is that there is actually something that can be done. There is relief that we can provide. Once we do the whole evaluation and we're able to identify the areas that need the amplification and the sound therapy, and we do a follow-up program together that will be spread out between 2 weeks, 1 month, 3 months, 6 months, and a year, then we're able to do that proper rehabilitation towards better hearing and relief from the tinnitus.
Thank you, Eva. So what I'm hearing you say from an audiological perspective is that there is amplification that can help provide relief, and there's also sound therapy that can also help provide relief for the patient. Dr., are there other medical interventions for patients who are suffering from tinnitus?
Yes. So as we started by saying, we said tinnitus is a symptom, because we said it is something that is only perceived by the patient. And so for every symptom medically, there is something that is a cause of it. So for us medically is to mainly look at the cause of that tinnitus. So if the audiologist finds that the hearing is okay and they try to give you sound therapy and you're also not responding to it, for us as the doctors, we go back to the drawing board. So what medications are you taking? Is there any medication that could be causing the tinnitus? Is that medication associated with the tinnitus? Then you need to stop it. Are you having a flu, or do you have a medical condition that could be causing the tinnitus? Such as things like wax impaction in the ears can cause you tinnitus. If there's wax, we can syringe it. We remove it and it is sorted out and the tinnitus goes away. Are you having a flu? We can treat the flu and the flu can go away. So anything we find that is treatable. If you're having issues with the high cholesterol, such that the cholesterol is being deposited in your blood vessels and it is causing the tinnitus, we give you anti-cholesterol medication. So sometimes you might have tinnitus, and if the audiologist clears you, we have to look for other things that could be causing you tinnitus before we tell you now it cannot be sorted. There's a special category of patients who have tinnitus, who either are depressed or they have mental illness, or the tinnitus is so bad it has caused them to have depression and mental illness. Now for that category of patients, we usually send them for cognitive behavioral therapy. So what cognitive behavioral therapy means is that, and even for people who have undergone management and it is not helping, The cognitive behavioral therapy, what it does is that it is a psychologist who helps you to develop coping mechanisms, or who teaches you different coping mechanisms that help you, one, come out of the depression, two, deal with the anxiety the tinnitus causes you, three, helps you also to, if you have any depression, to come out of it, and teaches you how to ignore or how to suppress the tinnitus, because it's mainly a psychological thing. And that way you're able to live and cope with it in a better way.
Okay.
Yes.
Understood. So, Dr. what I'm hearing you say is tinnitus is often a symptom of something else going on with you.
Yes.
And as the doctor, you would then try and understand what is lying beneath this symptom.
Yes.
And there are solutions. So the common message here is that there are solutions for patients suffering from tinnitus. And so as we bring this to a close, people are watching us from all over the world, and perhaps they already know of that 1 in 4 who is currently suffering from tinnitus. What would you say to them, Eva?
Yeah, so what I would say is that the best place to start from is get to seek medical attention. You could start off from seeing an ENT doctor, or you could walk into any audiologist near you, so that you can start by getting the hearing evaluation done and a proper treatment plan given to you to get relief from your tinnitus.
Thank you, Eva. And for you, Dr. what would you say to a person who has a loved one who is struggling with tinnitus, or they themselves are struggling with tinnitus?
Okay, I think Eva has basically pointed out the main things to do is to seek medical treatment, because we need to know what is the cause of your tinnitus. And even if we don't find a cause, there's a solution. Even with advanced technology, the audiologist is able to walk with you on your journey with tinnitus to the point where it stops being bothersome. And still the audiologist can work together with the psychologist, and they can teach you on how best to suppress the tinnitus. There are also applications. The audiologist can teach you how to use different apps in your smartphone that give you a natural soothing sound that can help you deal with the tinnitus. So there are answers. Don't sit at home with your tinnitus.
Okay.
Just seek care. Yes.
Thank you, Dr. There's something very important you've said, and Eva, I would like you to expand on this. But Dr. has mentioned that there is technology that can help. Can you tell us a little bit about the technology that's available now for patients that can help with tinnitus?
Yes, so we have tinnitus masking technology, and I could mention what I know, from Starkey. We have different, devices which now will provide the sound therapy to help now mask this problem and bring it down to a level that it's no longer bothersome. And at the same time provide relief or better hearing if we do find that there's a hearing problem. Yeah, so we have that, and we also have other ways that we can, from counseling, be able to have a proper lifestyle being, addressed, so that we can also avoid the aggravators or whatever is worsening the tinnitus at the same time.
All right.
Yeah, so technology is there, it's available, it is personalized depending on the patient.
Okay.
Yes.
All right. So viewers, you've heard it for yourselves. The two professionals are telling us that there is available solutions in the market today. So if you know that 1 in 4 people that is currently struggling with tinnitus, please spread the word. There is relief, and relief can be found here. And so, Dr. perhaps you can let our viewers know how, if they would like to contact you, if they have any further concerns or questions, how can they do that?
They can, I mainly work, I am a doctor stationed as an ENT surgeon at Kenyatta University, teaching research and referral hospital. So they can come to the hospital and they can get to see me. We have other ENT surgeons, or they can go to any other ENT clinic or ENT surgeon available. They'll be able to treat you and refer you to an appropriate audiologist. They can also, you can project my number, or you can catch me on 0720 710 617, and yes, so that is where I can be found. Yes.
All right. So in the interest of time, ladies and gentlemen, it has been my pleasure to be part of this conversation. I hope you have learned as much as I have, and I hope that you have information to help you make a better decision today so that you break the cycle of tinnitus and you start living your best life today. Dr. it has been my pleasure to host you today. Thank you for sharing the information with us. Thank you for sharing this free consultation with all of us. Eva, thank you so much for making the time and being able to share with us your experience and helping all of us live better and heal better. Finally, it is my pleasure to thank our sponsors for today, Starkey Hearing Technologies in Africa. Starkey Hearing Technologies is the world's most innovative hearing technologies providers, and our mission as Starkey Hearing Technologies is to build caring devices that help you live better and hear better. Thank you so much, everyone, for being part of this conversation, and we look forward to seeing you next time.
My name is Alice Litunya. I'm a Kenyan, and I live in Nairobi. Occasionally, I live up country with my mother. Tinnitus is a problem that impacts on people's lives. I remember I had this cold. It lasted a month. I used to have this problem of hearing some noise in my ears. And it used to come when I have a cold. When the cold goes, it will go away. So I thought it was something that comes as a result of a cold. But there's this time that I had a cold for 1 month. And when it left, tinnitus did not leave. It's the noise that you hear from your ears throughout day and night. This sounded like the various noises you hear when you are standing under a transformer. And it was difficult. I couldn't sleep at night, so it's like you have 24 hours of day. But as I was seeking medical services, I was told that this would not go away easily, that it's something I have to learn to live with it. I could not imagine how I was going to stay spending lots of my nights awake. I visited various places for support or to just find out how they could help me. I visited a place and I was referred to Starkey. When I arrived here, I was pleasantly surprised when they told me that they had a gadget that could help me. I was thrilled. I said that I'm not going to have these nightmares. So I talked to them. They were very kind to me. Whenever I had an issue, they told me that I could just come and visit them. Very surprising that they were not asking for payments when they were supporting me. They were looking at my gadgets. They were asking me what issues I had, and for quite some time I was happy. I was happy because they had changed my life. I would advise them to see an audiologist because there's a solution. There's a solution to their problem. There is relief, which is very important. There is relief. I was able to be given these gadgets that I don't have to remove the battery in and out. Since they are automatic, they are rechargeable. I can remove them, put them in the charger, my phone light, and take them out and put them on my ear. I can use them anytime. I can use them at night. I can use them during the day. And that was a great relief for me.